for your participation.
This meeting is being recorded.
Your host today is Sosu Østjylland in Denmark. My name is Annie, and my dear colleague Bodil, she will in a minute give a short introduction to this project. AFC Toolkit. And Lisbeth, my other colleague, she'll be supporting with photo and so on. Thank you very much to our dear partner from Italy, who will support us with technical matters. And welcome to Lone from Dementia-Friendly Society, who will give us a presentation later on. Right now we are gathered. How many participations?
21.
20. Yeah, 21. Yeah, thank you. So nice to meet you all. And the agenda for the next hours are as follows. First of all, Bodil will give us a short presentation of this AFC Toolkit project. We'll make a roundtable, and then I will introduce you to the two topics for today. And we'll have a presentation and feedback on learning outcomes and learning content. And then there will be a presentation from Dementia-Friendly Denmark about the work of the society and the dementia symbol as we use in Denmark. And at the end, we will have some exchange of good practices. We have changed some simple PowerPoint slides, which we hope you understand. Feel free to ask questions during the presentation. Bodil, please, you want to continue?
Yes, I'm ready.
Yeah.
Lisbeth?
Yes.
So, hello, my name is Bodil. I'm also working here at Sosu Østjylland, and I would also like to welcome you all. So this webinar is taking place within, could you go back, Lisbeth? So this webinar is taking place within the framework of the project AGE-Friendly Toolkit, Open Educational Resources for Age-Friendly Cities. And it's an Erasmus Plus project, and it runs from October 22. We started in October 22, and the project will end in spring 2025. Lisbeth? Our project partnership consists of partners from 5 different countries. We are from Spain, from Italy, from Denmark, from the Netherlands, and from Belgium. And the partnership represents partners from different sectors. So we have educational institutions, we have consultancy, we have federations, and we have NGOs. And finally, we have a European network. Yes. So why are we making this project? We all know that the populations in Europe are getting older. We simply live longer. And this brings some new challenges to our society, a need for them to be more age-friendly. So we also know that the people, the staff working in the vet systems need to have more skills on and have new professional profiles. And also we know that we need to involve our municipalities as a relevant actor to develop our age-friendly cities. So what is Age-Friendly Toolkit doing? What are we making? What are the outcomes from our project? So first of all, there is already a lot of information, a lot of knowledge existing in age-friendly cities. And these information we want to gather, we want to exchange information, and based on that, we will define a training curriculum and develop and test a learning content and a set of open educational resources. So the project has two main phases. The first one started in October 22 and will last till November this year. And here we are working with the proposal of a training curriculum for inclusive aging. And in the next phase, we will then develop educational toolkit for the development of age-friendly cities. And here you can see the contents, the main aspects of the training curriculum we are developing. So what we are going to do is to identify key competences, and then after that to define the learning outcomes of the new professional figure in age-friendly cities, then propose a training curriculum, and finally to validate and to disseminate our results. So a part of this project is also to have webinars. And maybe some of you participated in the webinar we had previously. This is the second one, and there are more to come. And during these seminars, we will present the skills, the knowledge, and the attitudes of a professional, and to develop and promote learning outcomes and learning content. So thank you very much for you to participate in these webinars, for us to receive feedback from you in our work. This slide is about learning outcomes. And here we are mentioning the definition of CITEC for learning outcomes, which is statements of what an individual should know, should understand, and or be able to at the end of the learning process. So these are our learning outcomes. This is for us the definition of the learning outcomes in this project. And here finally, you will see the overall learning outcome of our Age-Friendly City Toolkit project. We consider that by the end of the project, the student will be able to identify the benefits of targeting the themes based on desire. So this is related to knowledge, also to manage different resources. This is related to skills. And finally, last but not least, the attitude of the person in question. So this was like an overall view of our project. And I think that we will now, Annie, go to the roundtable. Is that correct? Okay.
Yes.
So, yes. So
thank you very much, Bodil.
You're welcome.
Do you want to finish it, Bodil?
No,
sorry.
I just wanted to start the small roundtable.
Yeah.
Yeah.
Thank you.
So
very good idea. Yeah.
By roundtable, we simply mean a short presentation of the participants of this webinar. And I can see that we are 21 participants. So I would kindly ask you to introduce yourself very shortly with your name, your country, and your professional background, such as like I would do it. So I am Bodil. I am from Denmark. I am a social anthropologist, and I'm working in social and healthcare projects. So if you could all please very shortly introduce yourself, starting with Sarah. Sara.
Hi, I'm Sara Beccati. I came from Italy and I work in a NGO called Anziani Non Solo, a partner of AGE-Friendly City project.
Thank you very much. I think that is fine because Sara, we are 21, so we have sorry to interrupt you, but we are 21. So Annie, please. Annie?
Margareta, okay.
Annie? Annie, are you there? If not, we go to Margareta. Margareta, please.
Yeah, Margareta Karlsson. I am from Sweden, and I am a specialist nurse and working at University West. And my research is about caring and health sciences.
Thank you very much, Margareta. Alison, Policy and Programs Management. Are you here?
Yes. Okay.
Yeah, hi. My name's Alison. I'm the Policy and Programmes Manager with Active Retirement Ireland here in Dublin, and my professional background is as a health psychologist.
Thank you very much, Alison. Abdallah, please, are you there?
Yeah, my name is Abdallah. I'm from Norway, working as associate professor at the VID Specialized University. I have a nursing background and PhD in public health. That's me.
Thank you very much, Abdallah. Agnieszka, please.
Hi, I'm Agnieszka Cieśla from Poland, from Warsaw. I work at the Warsaw University of Technology. And my background is architecture and urban design. And recently I'm focusing on dementia-friendly design.
Thank you very much. And Anna, please. Anna Irina.
Hello. My name is Ana Irina Lecădincă. I'm a lecturer at the Faculty of Geography, Bucharest University, Romania. I'm interested in human geography and also aging issues connected to demography and tourism.
Thank you very much, Anna. And
Thank you.
Angel, it's your turn now, please.
Hello, good morning. This is Ángel Yagüe from Spain. I work for the Spanish Confederation of Older People Organizations. I am the coordinator of the project. My organization is the applicant organization, and I'm very happy to having you here. This is our second workshop, and I think that it will be a very interesting and successful experience. So once again, thank you for participating in this meeting, and I hope you will find this event very interesting.
Thank you.
Bye
Angel.
for now.
Thank you. And Clara, please.
Hi, hello, good morning. I'm Clara. I'm from Spain. I'm a sociologist and I'm working for the organization Edad Dorada, Mensajeros de la Paz, and I'm also part of the AGE-Friendly Toolkit project.
Thank you very much, Clara. Daniela Korac-Mandic.
Yes, hello everyone. My name is Daniela. I'm from Novi Sad, Serbia. I'm a medical doctor working at a local NGO, Novi Sad Humanitarian Center, and I am also involved in several projects dealing with the elderly.
Thank you very much, Daniela. And Georgia.
Hello, everyone. I'm George. I come from Sombor, Serbia. I have a background in medicine and technology currently, and together with Daniela and as a part of Tara International Consulting, we are implementing the AGE+ project.
Thank you very much, Georgia. And Fiola, please. Fiola, please, are you there? Okay, we will ask then Ilenia, please.
Hello, welcome to everyone. My name is Ilenia Ageno. I'm Research Project Manager at AGE Platform Europe. AGE Platform is an association of and for people age 50 plus working at European level, and AGE is one of the partners of the project. Nice to meet you all.
Thank you very much. And Joanna, please.
Good morning. My name is Joanna. I'm an architect, Portuguese. My office is in Portugal, but I'm living in Switzerland now, and I just enrolled a PhD program, and my theme is aging and housing.
Just a moment. Yes. Arina, please.
Hello, good morning, everyone. My name is Karina. I'm a designer and a gerontologist. I work at the research, the Bavarian Center for Digital Health, and as a research assistant. And I'm interested in topics about design for an aging society.
Thank you very much, Joanna. And Katarina, please.
Hi, my name is Katharina. I am from Austria and I work as a program manager at Volkshilfe, an NGO. And I'm also currently leading a program in Serbia and in Kosovo for age-friendly communities. Thank you.
Thank you very much. And Katarina, please. Lisbeth, maybe? Lisbeth, please.
Sorry, we are having some technical issues with Annie's computer, so we're changing. So, yeah, sorry.
No problem. Please, Lisbeth. Lisbeth, please, could you introduce yourself shortly? You have to unmute.
Yes, sure. Sorry, I'm trying to multitask here. My name is Lisbeth. I am a project manager at SOSU Østjylland, and today I trying to figure out how to do technical support as well. That's normally not a part of my job description, but yeah, nice to meet you all.
Thank you. And Luna, please, could you also shortly introduce yourself?
Yes, my name is Lone. I'm head of the People's Movement for Dementia Friendly Denmark, and my background is communication and psychology.
Thank you, Lone, and we will hear you later with your presentation. Pamela, please. Pamela Suero.
Hi, my name is Pamela Suero. I am a PhD researcher working in Brussels at the BUB as part of another EU Horizon 2020 funded program called Homage, which is working with aging in place, ageism, social rights of older populations in Europe. I am originally from the Dominican Republic, and my background is in economics and social policy. Thank you for having me.
Thank you very much. And I think that Fiola just wrote a message to us saying, I'm sorry, I can hear you. And Fiola tells that she's a psychologist and from Zurich in Visionit. Yes, so thank you very much, Fiola. We can't hear you, but we can read your message. Thank you very much. And have we heard everybody now?
No, I haven't introduced myself yet, if I can. I'm Professor Malcolm Fisk, Professor of Aging and, Professor of, Active and Healthy Aging at the University of Central Lancashire in the UK.
From the UK, thank you very much. And are there others we didn't hear? If not, I will say thank you very much. It's very interesting that we are representing so many professions, so many sectors. And I think I also want to thank you for being very short and very clear, all of you. So I will leave the floor to you, Annie, to continue our webinar.
Thank you very much, Bodil. In this webinar, we will present and collect feedback on learning outcomes and learning contents regarding community support and healthcare and communication and information, with special focus on people with dementia or other brain disorders. But now we want to get the definitions right. Community support and healthcare can be defined as the provision of essential services, resources, and social support system designed to promote the well-being and quality of life of older adults within a community. As examples of community support and healthcare, it could be community wellness programs, accessible transportation services, memory clinics, senior centers, home healthcare services, or fall prevention programs. Providing a seamless continuum of support for people with dementia remains a challenge in many instances, and in particular for community services. People with dementia need access to a full range of risk reduction strategies that include, for example, maintaining social interaction, nutrition, or physical activities. Broader use should be advocated for dementia care pathways, with a focus on primary health care and early screening and diagnosis.
Sorry, Annie, we can see the screen properly. You need to share the slide in a entire way. Yeah. It's not the right view.
Can you see the screen now?
Yes.
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 Is it okay?
But you need to click on the full screen because we see the PowerPoint slides.
Okay. Can you see the slide with the situation in European countries about community support and healthcare?
No.
No?
No.
I'm so sorry.
Perhaps Sarah or Hangel, you can share on behalf of Annie the presentation.
Okay. Okay. Angela, I will do.
Can you see the screen now?
No.
No.
I need the time to download the presentation.
Okay.
I try to share the. Okay. Okay. Now it's visible, but can
Can you see the screen now?
Yeah. Yeah.
I'm so sorry.
Maybe it's better if you use the slideshow method.
Can you see the slide with the introduction for community support in healthcare?
Yeah.
Okay. Let's take the next one. Please. Yeah. That's okay. And now it's just to follow up about the definition of community support in healthcare. In most countries, divide financial, legal, organizational, professional between health and social care leads to inefficient allocation of resources and is particularly felt by older people in need of different types of care. It can lead to delays and uncoordinated service delivery, lack of information, financial burdens, long waiting times, and reactive rather than preventive service approaches. Older people prefer to stay at home as long as possible, in many cases with a partner or another family member caring for them. Nevertheless, such care arrangements need to be facilitated by professional health and social care services, and sometimes also by residential care facilities and primary care structures, for which local government often have an important coordinating role. There are differences between countries in how we care for people with dementia or brain injuries. In some countries, families care for the person with dementia in their own home, and in other countries, there are special institutions developed to be particularly dementia friendly. In some countries, the healthcare is for free, paid through taxes, and in others, it's a full co-payment.
Really, okay. Because Lisbeth, before it was impossible to see the slide we are presented.
Yeah.
Okay, it was only visible the cover of the first page of the presentation, but now I think it's okay. We are seeing the situation in European countries slide. Is it okay?
Yeah.
Okay.
How we define communication and information. The goal of intervention in this domain is to assist older adults in accessing timely, reliable, relevant, and understandable information about their community, ways of engagement, available services, and health topics through word of mouth, general press, or the use of information technology. People with dementia or other brain damages have special needs. At the end of the webinar, you will be presented with a link to a mini guide made as a video with 7 tips produced by the Alzheimer's Association with English subtitles. If we look at the situation in Europe, you can see that about 8.5% of the elderly population is estimated to have dementia. It's about 1 million people younger than 65 years of age are included. So there are approximately 14.1 million people with dementia. Yeah, if we look at the numbers, they almost speak for themselves. Now to the learning outcomes, where we need your feedback. We have, based on the submitted material, we have taken the liberty of summarizing the learning outcomes from 11 to 5, as there are several overlaps between the two themes, community support and healthcare, and communication and information. First of all, the learning outcomes will be a comprehensive understanding of aging and dementia. about understand the physical, cognitive, and social changes related to aging with a focus on dementia and other brain disorders. Secondly, as a learning outcome, evidence-based dementia care. Apply evidence-based dementia care knowledge covering diagnosis, treatment, and management strategies for individuals and their caregivers. As a third learning outcome, utilization of community support resources. Utilize community support services such as memory clinics and respite care to enhance the quality of life for older adults with dementia. As the fourth learning outcome, we have defined dementia-friendly environment creation, meaning implement dementia-friendly design principles to create safe, inclusive environments promoting independence for individuals with dementia. And as the last learning outcome, effective communication and care planning. And it is about demonstrate empathic communication, develop individualized care plans, and collaborate with multidisciplinary teams to provide person-centered care for individuals with dementia. Now we please will ask you to make your feedback on these 5 learning outcomes. Concerning the learning outcomes identified in this presentation, which one is the most important to enhance regarding community support and healthcare? B, communication and information. Please write in the chat your answer. And I'll give you 3 minutes to that. Thank you very much. I hope you have the time for write your answers. We will go further on to the learning contents about communication and information. And we have the following suggestions for headline content. One unit, understanding age-friendly cities. We suggest that we have an overview of the concept and principles of age-friendly cities, exploring the specific communication and information needs of older adults in urban environments, and understanding the social, cultural, and environmental factors that influence communication in age-friendly cities. As a second unit, we suggest that we talk about communication strategies for older adults, effective communication techniques for engaging with older adults, including active listening, empathy, and nonverbal communication. Furthermore, we will talk about adapting communication approaches for individuals with dementia or cognitive impairments, and promoting intergenerational communications and understanding. That's for unit number 2. For unit number 3, communication channels in age-friendly cities. We suggest that we make an overview of interpersonal, public, and digital communication channels and their relevance to older adults. Understanding accessibility considerations for different communication channels. Evaluating and utilizing appropriate communication channels to disseminate relevant and accessible information to all older adults and their communities. Furthermore, a 4th unit about collaborative communication and partnership building. It should be something about collaboration and coordination strategies with community organizations, local authorities, healthcare professionals, and advocacy groups. Developing partnerships to enhance communication and information provision in age-friendly cities. Effective communication with diverse stakeholders to foster dialogue and collaboration. As a 5th unit, we suggest supporting individuals with dementia or brain damage. And in this unit, we focus on understanding the unique communication challenges faced by individuals with dementia or brain damage. We suggest strategies for adapting communication to meet the needs of individuals with cognitive impairments. Creating supportive environments and resources for individuals with dementia or brain damage. As the 6th unit, advocacy and empowerment for older adults. In this unit, we'll focus on understanding the rights and needs of older adults in age-friendly cities. Advocating for inclusive and age-appropriate communication and information practices. And last but not least, empowering older adults through education, skills development, and access to information. And as the last unit, the 7th, continuous learning and professional development. Staying updated with research, best practices, and emerging trends in the field. Focus on professional development opportunities for enhancing knowledge and skills in communication and information for age-friendly cities. And reflective practices and self-assessment to identify areas for improvement and growth. So now again, we'll please ask you to write your opinion about this. About the learning units described in this presentation for communication information. Which topic are the most important? And can you name topics we are missing? Please write your answers in the chat. Thank you very much. Now we will look at the learning contents about community support and healthcare. And these learning units provide a structured framework for professionals to develop a comprehensive understanding of community support and healthcare, with a specific focus on dementia-friendly initiatives in age-friendly cities. They address the knowledge, skills, and attitudes necessary to effectively support individuals with dementia and their families, promote their well-being, and create inclusive and supportive communities. We suggest following learning units. Unit number 1, understanding aging and dementia. Overview of the aging process and its impact on physical, cognitive, and social functioning. In-depth understanding of dementia, its types, causes, symptoms, and progression. And furthermore, recognition of the unique challenges faced by individuals with dementia and the family. For the second unit, we suggest dementia care best practices. It contains evidence-based approaches to dementia care, including diagnosis, treatment, and management strategies. Furthermore, person-centered care principles and strategies to enhance the well-being and quality of life of individuals with dementia. And then, effective communication techniques for engaging with individuals with dementia and their families. For the third unit, we suggest the topic, dementia-friendly environment design. principles of creating dementia-friendly environments, including accessible infrastructure, clear signage, safety measures, and home adaptations. Also understanding the impact of the physical environment on individuals with dementia and strategies for optimizing it to support their independence and well-being. As the fourth unit, we suggest community support services and resources. And it contains of familiarity with available community support services, programs, and resources specific to dementia care, such as memory clinics, support groups, respite care, and specialized healthcare services. Knowledge of local and national resources for individuals with dementia and their families, including advocacy, organization, and legal assistance services. The fifth unit, we suggest care planning and coordination. And it contains something about developing individualized care plans for individuals with dementia, considering their unique needs, preferences, and goals. We also suggest that in this unit is something about coordinating and managing comprehensive support services, including healthcare, social services, and community resources. Furthermore, collaboration with interdisciplinary teams and effective communication among team members. For the sixth unit, communication in interpersonal skills. It contains about effective communication strategies for interacting with individuals with dementia, their families and caregivers, including active listening, empathy, and validation techniques. Also, conflict resolution and managing challenging behaviors in individuals with dementia. Building trusting relationships and fostering a supportive environment for individuals with dementia and their families. In the seventh unit, we suggest that we talk about ethical and legal considerations. It contains something about understanding ethical dilemmas and decision-making processes in dementia care, including issues related to autonomy, consent, and end-of-life care. Knowledge of legal frameworks and regulations relevant to dementia care, including capacity assessment and advanced care planning. And for the eighth unit, we suggest continuous learning and professional development. And as in the previous subject about communication and information, it's about staying updated with the latest research, best practices, and advancement in dementia care and community support. Engaging in reflective practices and self-assessment to identify areas for improvement and growth. Seeking professional development opportunities such as workshops, conferences, and online courses to enhance knowledge and skills in dementia care and community support. It is our suggestion for the contents of the learning units for community support and healthcare. And now we'll ask you, please, write your answers in the chat. Which topic are the most important, do you think? And can you name topics we are missing? Thank you. Thank you very much, everyone. And now the next in the program is that I will welcome you, Lone, and thank you for joining us today. And I will now leave you to the audience.
Yes.
And will, I have, or Lisbeth, she asked you to say next, and then she'll change the slides.
Well, I can try to share my PowerPoint from here, then I'm in charge. And if it doesn't work, then Lisbeth could maybe, or do you prefer the other way around?
We have this technical problems. So I think perhaps if it's all right for you that Lisbeth will do the changes. Is it okay?
Yeah, well, is it Lisbeth, is it in the same PowerPoint as you're in right now, or is
yes,
yeah, okay.
It's in the same PowerPoint, yeah. Is it okay?
Yeah, I changed a little, but if this works for you, then I'll be fine. It's okay.
Thank you, Lone.
You're welcome. And thank you very much for having me. If you have any questions along the way, I can't see you, but please just yell out loud. Can everybody hear me? Probably. Okay. And you can hear me. So anyways, no, that's fine. Okay, the people movements of dementia-friendly Denmark. So why is that? Actually, Angel, you wrote it very well in the chat just recently. You wrote that people with dementia feel excluded. And that's actually why we're here, because you are very right. They isolate and they feel ashamed and they stay at home. And we definitely want to include people with dementia in the society as well. So we find working with dementia-friendly society, Denmark society, we also work with like elder-friendly society, because if we make things dementia-friendly, actually we just make things friendly for everybody, including ourselves. The primary, this is the dementia symbol in Denmark, and I'll take you through why and how we develop it. Which thoughts we had about it. But I just want to say the primary target group for this symbol is people with dementia, with mild or moderate dementia, still living in their own homes or still using the public space. Yes, please, Lisbeth. Excellent, thank you. So, why a symbol? Is that not putting people with dementia on the spot? Is that not like highlighting them? And we ask ourselves that question. We also ask people living with dementia the question, is a symbol the answer? The government gave us an assignment under the headlines, better help for people with dementia in public spaces, and added dementia symbol. And we kind of like, we didn't know if a symbol was the right answer to the question, better help for people with dementia in public spaces. So we made these two reports. And if you click one more, Lisbeth. No, go back, please. It was on the other, sorry. We made these two reports and we asked about 6,000 respondents in the questionnaire. We asked people living with dementia, we asked relatives, we asked people working with dementia, we asked people volunteering in the area with people with dementia, and we asked the broader populations. Because we wanted to know, is this a good idea? Is a symbol the answer to the question? And how should we move on? Should we move on? So we wanted these reports to point us to the right directions. And then you can change this, but thank you. So what we found out in short, this is a very long report, but what we found out in short is that yes, it had potential. There was a lot of all of these people, both people with dementia, relatives, and workers who said, yeah, we should definitely try to go for this and see how it would work. So we moved on with the assignment, and if you click one more, we also asked in these reports the willingness to wear something visible, because we know that there is this dilemma that we have dementia and it is a taboo, and there's a lot of stigma, and there's a lot of shame, and there's a lot of feeling excluded. So would people living with dementia wear something visible that shows that they have dementia, that they're living with dementia? And as you see here, now this is the Danish text here, but I'll just show you. This is the first one with the person in is people living home, people living with dementia still living in their homes, and the second one with the heart and the bubbles here are relatives. So we asked them if they're willing to go with something visible, and the first green hand here says 20%. And the next green hand is like, yes, I want to wear something in certain contexts. The next was like maybe, and the last was no, I don't want to wear anything that's visible. So if you move on, now we have the feeling of, okay, this do have potential making this simple, and we wanted to make sure that we don't push on the stigma, the taboo, or the feeling of not being included in the society. So this is people, oh, no, can you click back? Yeah, thank you. There's coming five statements of, this is people living with dementia, and we had 2 groups involved in the development. And together with these lovely people, we discussed meanings of symbols, we discussed colors and shapes, and whether it should say dementia or not say dementia. And of course, there was so many opinions, as many opinions are as there are people living with dementia. Someone wants to shout out loud that they're living with dementia, and others want to rather not talk about it at all or acknowledge that they have it. But we did find a common ground, and if you just click on, I'll just take some of the statements from these guys. This was one saying, I don't care how it looks, just as long as it's supported by the communication, because communication is very important. People with dementia using a symbol want to know that the society also knows the symbol, of course. And if you click one more, and this guy was saying like flexibility is important, and which states of dementia you're in, so that you can choose an object that's visible or not. Yeah, Lisbeth? It's a really good idea, and we were discussing a kit, like a dementia kit with different kinds of objects in it, because it's about the context you're in, someone is saying. Yeah. And like, yeah, it should not say dementia. Yeah, it should say dementia, and all kinds of different opinions. But we did find common ground. And if you click one more time, Lisbeth. So this is what we ended up with. A kit, a toolkit with the symbol. This is a hand, and the hands is expressing that we also need a helping hand, as you can see here. It applies not least for people with dementia who particularly needs a little more time, a little more patience, and sometimes a helping hand. But what's very important about this symbol is there's 2 hands. So there's a hand from people with dementia, but there's also a hand from the society, because the society, all of us need help to help people with dementia. So if we can see that this person has dementia, we know how to help. And we cannot see, fortunately, we cannot see that people have dementia, because there's not a broken leg or something we can hang on to. What was important was that there is these different objects. So as you can see, you can wear it on the jacket or on a shirt, and that's quite visible then. But you can also, these 8 marks is like, how do you say that, stickers. And you can put them on your Visa card or on your Travels card or your health card. So if you put them on the card, you know, when you show it to the people where you're buying your stuff, or where you're, if you're going on public transport, then you know it's just these people who can see it. It's not everybody, but the people who is relevant to see it can see it. So this is actually what is making the symbol quite successful in Denmark right now, that there is different possibilities how to use the symbol, and also that is volunteering, because no people with dementia should use this if they don't like to use it. But what it also can do, this symbol, even though no one is using it, or if no one was using it, is that it's a good way of getting a conversation about, why do I want to wear it? Why do I not want to wear it? Is it because I'm embarrassed that I don't want to wear it? Is it because I think people would put me in a box if I wear it? Or why do I don't want to wear it? So it's a good opportunity to get a discussion, or get a talk about me living with dementia, and why do I want to use it, and or why do I don't want to use it. So if you click one more time, Lisbeth. Yes, and we keep asking. You can click one more time. We keep continuing to involve the people who we are trying to help. So nothing about them without them. And if you click one more time, we are so lucky that all of these people are living with dementia. And as you can see, there's I think the youngest one is 50 and the oldest one is probably 76 or something like that. So there's all these lovely people living a life with dementia and wanting to live a life with dementia. And they just want to be able to go down and buy a bottle of milk and not be looked at as widows if they suddenly stand still for a longer time, or can't find the Visa card, or something else. And they just want to be able to continue to play badminton in where they have always played. So the people around them just take a little more patience, and they just want to be able to still go to the theater and still just use the public spaces like all of us, as long as they can. So we are so lucky that all of these people, we have gathered them in we call it a dementia-friendly network. So they help us do our work. They help us communicate. They help us be the faces on the focus we have in trying to make Denmark more dementia friendly. And it's very useful because people don't know that you can have, well, there's a lot of people still not knowing that you can actually be 50 years and going mountain biking in the woods in the weekends and living with dementia. So there's a broad, there's a big difference of people with dementia, and we want to tell that to the society as well. And if you click one more time, yes, this is just some of the statements as well for people using or not using it. And I'm just going to read them out loud. I don't think I want to advertise to others who don't really know me. Unfortunately, you're quickly put in a box. And that's what, Ankel, you also wrote, the exclusive part. You get exclusive from the society. That's what people feel when they get dementia. And they feel ashamed about something they're not actually in control over. And another thing, if I'm having a bad day, the words don't always come that easy. Then I bring the symbol with me. It can provide reassurance on days that are worse than others. And a wife is saying, my husband goes outside the home himself. The symbol is a reassuring that he, if he can't find his way home, so he feels safe. When I wear the symbol, this is a guy, I get the courage to do more things myself. Then I know that someone will help me if I need to. So, and the last one is saying the population should know more about it before I think it makes sense to use it. So that's kind of like the dilemma. Who's going to use this first, and or if am I just going to use it when everybody knows it? Yeah, Lisbeth, I think you can click one more time. We have a week each year, a dementia week, where we focus on dementia, the symbol, and the stories about all these people living with dementia. And we, in 21, we launched the national symbol. And each year we focus on a different, what do you say, part of society, because it's very difficult to hit all the society at once. So in 22, we focus on the retail. So we try to get knowledge out to everybody working in retail. So we know that if I go down and buy a bottle of milk, I will know that my the ones working there will also hopefully know the symbol. Not everybody knows it yet, but we're working on it. This year we were focusing on getting safely from A to B, and that's both by walking around the area where you live, but also with public transportation. And we got all the public transportation companies to communicate both to their employees and to their customers. And next year we have focus on culture and leisure. And yes, you can click one more time. The people movements are founded by these organizations, and that's, as you can see, the Alzheimer's Union and all kinds of different organizations that either work with people with dementia, with relatives, or have employees working. I think that was about it. If there's any questions, please just hit me.
Are there any publications in English about your activities?
I think I might have a one-pager actually, and I could share that with you.
Okay.
I would like to say, Lona, thank you for your presentation. I think that it is very interesting. And we have in our organization, last year we had a project, and we were working with the Spanish Confederation of Alzheimer. We studied the situation of dementia-friendly communities and cities in Spain. We are in our country, there is a network that joins more than 300 municipalities that are committed to Alzheimer's and support families and caregivers. But the general opinion of people involved in this project is that many things is needed, is still needed, because there is a wide knowledge. The knowledge is very short. There's a lack of knowledge of the disease. People don't understand what is dementia, and this is the big problem. So I think that we need to start working on this, what is dementia, because when we have this knowledge spreading to all society, I think that we have an opportunity, because there are experiences that we have shown in this project that was based in the UK concerning the commitment of economic sectors with Alzheimer and dementia. And I think, for example, it is very important that society start working on this, and learning process and training on dementia with simple courses, that it is not important that we have a long course, but courses of half an hour, short courses, short training courses are important in order to spread what is dementia. It's important that to listen to people with dementia too, because people with dementia are active and have feelings, and they complain about this because they have no voice in the society, because it's not important for the general society, his voice or her voice. So it's important to give voice to these people and to know what they need, what are their preferences. So many things are needed, and your example, the sample of the symbol in Denmark or other activities are relevant for other countries. So thank you for your presentation.
Thank you very much. And you're right. We try to start with just like saying, you just have to know the symbol and these three advices, and then we hope to get in the door and talk a bit more about it, because people in Denmark in general think that dementia, you're very old, you're sitting in a foster care and you can do nothing, and we need to kind of like, tell another story. And if you need anything, if you want to use the symbol in other countries, you just tell me and you just go ahead. It's for you as well.
Thank you very much, Lone. I was a bit curious. Do any of you know something like this about the symbol for dementia? Something similar in your country?
Well, I can share that this is new for me, and I like it very much. I think it's a great idea, and I like the symbol itself. I think it's also inviting. The two hands also mean that other people should get involved with this topic, with people with dementia. And I also think it's a good thing that this symbol probably creates a curiosity for the people who have never seen it. So they might ask, what is that? And that also can spark interest around the topic. So I really, really like this idea. And also I love the fact that you have been interviewing people with dementia, and that you are still having this dialogue with them. Really, really a great example. Thank you.
Thank you.
Yeah, thank you very much, Daniela. Any more comments on this? Otherwise, again, thank you very much, Lone. It's very interesting.
Welcome.
And please stay on, because the next step in the program is actually to discuss some good practice cases. And I hope you will contribute with what you have of good experiences where you come from, to inspire us all in these subjects like community support and healthcare, and communication and information. Anyone who wants to share their experiences? I'm sorry, I can't see the chat, but then again, Malcolm, yes, thank you.
Yeah, it's more an observation than a sharing of good practice. I did put something in the chat about the monitoring, surveillance, and data, but obviously there are a range of different technologies that are available, and I'm not so sure about some of the ones which people might carry, like with a mobile phone, and which could be help to locate people, most certainly. Clearly, there's some issues around people with dementia maybe not being cognitively able to activate certain kinds of devices and what have you. But there is going to be clearly a wider range of different technologies. that may be available both to people with dementia and carers of people with dementia. So I wonder if someone's got some observations about those and what merit some of them may have, or indeed what dangers there may be with regard to such technologies.
Thank you, Malcolm. Anyone who will contribute with something for Malcolm? I have some difficulties in seeing the raised hand, but then please say something out loud. Or Lone, do you know, have you been talking about assessment technologies, GPS and so on in your association?
Yes, of course. It always comes up, you know, the ethics about using the GPS, or also, of course, having the symbol, because then you also kind of like know what's going on. But we decided not to go into all of this technical tools about people wandering off, because our goal is to make the society aware so they can actually help if people are wandering off or being where they shouldn't be, or can't find their way home or something like that. So we didn't go into the ethics about it, but I know it's a big subject in Denmark, and it's discussed all over to elder care homes and relatives that wants to put this. This is also an issue with the dementia symbol, that we don't want relatives just to say it's good for me, so you have to wear it. So if the person says no, I don't want to wear it, he shouldn't be wearing it, or she shouldn't be wearing it. It has to be a kind of like a dialogue. And also if people in elder care homes that has a dementia and they're quite severe dementia, still have this dialogue about what is this symbol, kind of a dialogue. So that's just important to us. So no one should put anything, force anything to anyone.
Thank you. Any further questions?
Maybe I have a question regarding this week of dementia, which you will have in Denmark this year, about the mobility of people with dementia. Do you have experience with creating so-called dementia-friendly walking paths, walking routes in the cities? Are there any examples of that in Denmark? Because I read that in the Netherlands there are some already, and I wonder if in Denmark you also perhaps during this week you establish some.
Yeah, definitely. There's a lot of municipalities during this week that does these dementia-friendly walks, also in cities, but also in the nature. But we also have like one of the organizations that's a member at by Dementia-Friendly Denmark is also having like you know, they have what do you say? How do you say that in English? But they have, you know, weekly walks or monthly walks for people.
I mean something different. Not simply walks, but walking route, so that we have a system and some signs that enable those people to recognize.
And to actually do it themselves. I know what you mean, like universal design in a walking path. I think most of them are happening in the week of the dementia week, because it's kind of like an event. But I haven't seen, I'm not sure, but I could look into that. I'm not sure that anyone has it like regularly, like marked a walking route, but they definitely do it in the dementia week. But I think they put it down, you know, for the rest of the year.
But it's written here, it's the 19th week So when does it take place? It's now. It's in.
It's May. It's May in the. It's from 8. I think from 8 to 12th May or 11th, something like. Yeah.
Okay. So it already happened this year.
Yeah, we already had it. So we are preparing for the next year, for a week next year. And we do it. We have this week, United Week, because it makes. We can shout a bit louder when everybody's doing it, you know, so we can make a bit more noise and we can make people aware in another way when doing it in the same week. It's not like there's a lot of stuff happening all year, but this is kind of like the opportunity to make a big event.
I see. Okay. Thank you.
Welcome.
Thank you. Any further questions? Otherwise, I will, at the end of this, I'm sorry, I think I'll need Lisbeth's next slide. Yeah. We want to thank you very much for your contribution and cooperation. And for the next slide, yeah, I promised you at the end that I will show you that for Alzheimer Society, they have in English also shortly described some advices as a dementia friend. And they have made 7 tips. And at this link, they have made a video for inspiration for dementia friends. Do you all know the concept about dementia friends? Do I have it in other countries now? Lone, now I'll ask you again. Can you say a few words about dementia friends?
Yeah, you can say, well, they definitely have it in the UK, I know, and others also in some of the other countries. It's a kind of like a support symbol, you can say. So you have the dementia symbol that people with dementia use, and then you have the dementia friends, and that's a purple heart in Denmark. I think it's a flower in the UK. And if you have this heart or flower on your shirt, people would know that you have what you suggested, Angel, that people need more information about dementia. So these people have wearing these support symbols, you can say. They have some knowledge about dementia, and they have some knowledge about how to help and how to approach if you see someone struggling with something.
It's actually like a course you can take online.
Yeah.
And then you will have this symbol in your mail. Yeah. Yes. And we will try to show you it's a short video.
And if somebody is suggesting that we get the link in the chat, then we can maybe open it.
Okay. Yeah, I'll try again. Next step for this project, we'll keep on the development of the professional profile and keep on development of definitive learning units. And this project also develop an e-learning platform after having these workshops at national level. We are going to meet in this project group in November. And after that, we will present the results of the international. Yeah. So if not any more questions, feel free. Otherwise, you are always, you're welcome to contact us for further feedback or questions. Thank you all for participating in this webinar. We thank you for your contribution and hope you'll continue to follow the project. Thank you very much, Lone, for your presentation. And again, to all of you for participating in this webinar. We'll say have a great afternoon here from Denmark. Take care.
Same to you. Bye.
Bye.
Bye bye. Thank you.
Bye. Thank you.
Thank you. Thank you so much.
Bye. Thank you.
Bye. Thank you so much.
Bye-bye. Thank you. Thank you.
Bliver du hængende, Annie?
Yep.
Can I stop the recording?
Yes, please.